Local hospitals are taking a unique approach tonight to detect drug-addicted babies who might otherwise go untreated. As heroin devastates families in Greater Cincinnati, doctors and nurses here are on a trailblazing path to protect newborns.
Investigative reporter Todd Dykes joins us live now with the controversial program to test pregnant women for drugs. Todd.
Yeah, it certainly is, and it's happening here in Cincinnati and hospitals around here. It's called universal testing, and it's now commonplace at almost 24 area hospitals. Experts think we may be one of only a few cities in the U.S. testing every mother before childbirth. The results are already helping our most vulnerable population.
So this is Anna Denson. She's 18 months old.
Baby Anna, born healthy and happy.
There's nothing more amazing.
Anna's mom remembers giving birth like it was yesterday, including the questions she was asked by nurses.
Do you smoke? Do you have, how frequently do you drink alcohol?
Anna's mom, Dora Annam, knows how important those questions are because of the work she does with the Health Collaborative.
When we worked on this project, we kept going back to this issue of what about the baby?
The project Annam is talking about pushed hospitals in Greater Cincinnati to do more than just ask pregnant women about drug use. Since late 2013, 18 area hospitals have drug tested women by collecting urine samples. The purpose? To see if their babies are exposed to opiates or heroin during pregnancy.
We need to know if the baby's been exposed to opioids so they don't have withdrawal when they leave.
Dr. Scott Wexelblatt is an expert on the needs of newborns. He says nearly 8% of babies born in Greater Cincinnati are exposed to drugs in the womb. If the exposure involves pain pills or heroin, babies can develop neonatal abstinence syndrome. That means they're born craving the drug their mom used. While pregnant women can decline to be tested, only a fraction have.
Other states are making it criminal if you are testing positive. So our whole approach is this was a non-punitive approach.
Universal pregnancy drug testing has critics who call it too intrusive. Dora Annam admits when local health experts first discussed the idea, there were concerns not only about privacy but about legal liabilities. But faced with a growing heroin epidemic, hospitals took a unified stand, knowing testing can lead to healthier newborns. It's a model Wexelblatt believes will one day become the norm across the country.
I think it should be happening elsewhere, and I think it will be happening elsewhere in the future. This, in my opinion, should be normal prenatal care, and I think in the future it will be.
Well, supporters say the impact is easy to see. During a study at Mercy Anderson, a number of pregnant women did test positive for opioids. 19 of the women who tested positive did not present any risk factors during that standard Q&A screening process. It's likely those 19 babies would not have received any specialized care based on the way things used to be done. Todd Dykes, WLWT News 5.
Todd, thank you. Now, if a mom refuses to give a urine sample, her baby is still tested. And while Ohio law does not impose criminal penalties when tests are positive, Child Protective Services is notified. 18 Greater Cincinnati hospitals are participating in this program. Go to our website, WLWT.com, to see that list.